Hello everyone, it is good to see you. You're watching our continued focus on diabetes and related eye diseases as part of our initiative Netra Suraksha, India Against Diabetes. Now, we have spoken about the dangers of diabetic retinopathy and how it can lead to blindness if left undetected and untreated. We here in India have 77 million diagnosed diabetics. Only 22% get diagnosed for diabetic retinopathy. Why? Well, because there's a lack of awareness and gaps in screening. In type 2 diabetes, in fact, 67% patients develop diabetic retinopathy after 10 years, which means while a large number of people get affected with diabetic retinopathy, only a small number is actually aware of it. As part of Netra Suraksha, we have put up a self-checkup questionnaire that will help you and your loved ones evaluate if you have any symptoms that call for a detailed consultation with an eye doctor. You can check out the Netra Suraksha self-checkup questionnaire on www.news18.com/Netra Suraksha. Now, in today's episode, we will talk about how the fight against diabetic retinopathy is a two-front war, how both doctors and patients need to be equally involved in this fight. While doctors can help with referring, getting their patients screened on time and treating them, patients and caregivers as well have a role to play in being aware of every aspect of the disease and be proactive in both screening and treatment. Helping us understand this collaborative approach, our panel of doctors who are joining us today. Let me introduce them to you. Dr. Rajiv Raman is a senior consultant at the Department of Vitreoretinal Services at the Sankara Nethralaya in Chennai. Dr. Vishali Gupta, Chief of Retina and Uvea Services at the Postgraduate Institute of Medical Education and Research in Chandigarh. Dr. Mala Dharmalingam, Senior Professor at MS Ramaiah Medical College and Hospital, also Director and Head of Endocrinology at Bangalore's Endocrinology and Diabetes Center. Also joining us today, Dr. Ratna Devi, co-founder of DakshamA Health. She's also the founding board member of the Healthy India Alliance and the founding board member Asia Pacific Alliance of Rare Disease Organizations. She is also the director of Patient Academy for Innovation and Research and chair of the International Alliance of Patients Organization. I'm going to welcome all of you first on the show and start the discussion with Dr. Rajiv Raman. Doctor, if you are diagnosed with diabetic retinopathy, what is the next step for you as a patient? What are the right questions to ask your ophthalmologist?
I think the first thing as a patient, you must accept that you have one of the microangiopathy which has affected you, which is because of diabetes. I think that's very important. And the second thing is get others also checked up, the other parts like kidneys, because usually the retinopathy and nephropathy, they go together. I think that's the second thing. Ask your ophthalmologist what stage of disease I am having, because the early stage of the disease is a reversible stage of the disease. Later on, it becomes irreversible. Ask him when I should visit you next, because the only way you can prevent blindness because of diabetes is a regular follow-up, and your doctor knows how often you should come for a checkup based on the stage of disease you have. It's important again to keep the systemic factors, the HbA1c, cholesterol, lipids, all under control, because hypertension, they all play an important role. So I think check with your doctor what stage of disease you have, when I should come, whether I need some treatment or not, and keep all the things under control.
That's good advice. Dr. Dharmalingam, come in here. Regular screening for diabetic retinopathy is one of the primary ways of preventing the disease. Now, what else can a patient do to prevent it? And how is screening for a patient with type 1 diabetes different from someone who has type 2 diabetes?
Thank you very much. Yes, it is very important that the person is screened for diabetes. And there are also, apart from screening, there are high risk factors. Just like Dr. Ranjan was saying, your blood glucose should be controlled. You should ask a patient to do a HbA1c. The blood pressure and the cholesterol are all risk factors for getting diabetic retinopathy. Tobacco use, that is again another risk factor. And pregnancy and diabetes is a risk factor for getting diabetic retinopathy. How often we should screen? For type 2 diabetes, which usually occurs in adults, they should screen at diagnosis. When they are first diagnosed, they should screen. And after that, if there is no problem, they should screen every year annually. And then if they have a disease, then the ophthalmologist tells them how often they should come. In type 1 diabetes and retinopathy, the screening starts about 3 to 5 years after they have been diagnosed with diabetic retinopathy. The simple fact is the glucose might have been high in type 2 diabetes and the patient may not have realized, while in type 1 diabetes, usually it's a sudden onset, so they would know. So we usually say that you should screen about 3 to 5 years after the diagnosis. And if the child is very small, you can start screening when the child is about 12 years. And then, of course, after that, every annually, you should be screening the patient.
Dr. Vishali Gupta, come in here. What are the general apprehensions that patients have in getting themselves screened for treated for diabetic retinopathy?
Regarding the screening, I don't think patients are apprehensive. The problem is the lack of the knowledge. They don't even know that their retina could get affected. They are never educated about it. And I'm very, happy to learn that you guys are taking a lead in spreading the awareness about retinopathy and the need to get screening done, which is very important. So once they know the screening is required and they are, even if there is no retinopathy, they need to come every year. I don't think they are apprehensive of screening per se. Treatment, yes. Like Rajiv said in the beginning, that it's important for the patient to ask at what stage the disease is. Is it life-threatening? Is it sight-threatening, or is it the very early form of the disease? And I don't blame patients. We all have a tendency that we will get the treatment only when I have a problem. For example, in diabetic retinopathy, the patient may be seeing normal, but as a retina specialist, you can see that he's sitting on a kind of a time bomb and he can bleed anytime. But patient is not ready for treatment because he feels he's all right. So I think that kind of apprehensions can be managed when we do the pictures of the retina, we discuss with them. And the second apprehension is the timeline of the treatment. Like the standard question is, how many injections, how many laser sittings, how long I need to follow up. So I generally tell them that like your diabetes is treatment for the rest of your life. So think of the eye problem. It's not one-time solution that we treat it and you will be fine for the rest of your life. You may be, but you would need to be under constant observation.
Dr. Rajiv Raman, India loves home treatment. We know that. Kuch bhi bukhara, anything, the first thing you do is go to your kitchen and try and treat yourself. Are there any myths around diabetic retinopathy as well? Home remedies and non-medical treatments that one needs to stay away from?
We don't have evidence towards these home remedies, so definitely don't follow. But there are a couple of things which are myths in diabetic retinopathy. One is people feel that once they have retinopathy, they should not do any exercise. No, because it's a vascular disease, it will bleed, which is true in the late stage of the disease sometimes. But as Dr. Vishali rightly said, majority of disease is in the early stage. They do need exercise, so they cannot stop exercising. That's important. Many times they are afraid that they may have a bleeding, they stop their aspirin. Again, that is bad because that's good for their heart. And many times for eye, they stop and they land up with a cardiac problem. Another big myth is like, one doctor says or the physician says you need an eye checkup. And in India, majority of them, eye checkup means a change of glasses. So they'll just go to their optician, get the glasses changed. In diabetes, what is required is a dilated eye examination of the retina, the back part of the eye. So I think these are certain myths which are there with diabetic retinopathy. and we should be away with all these things.
Dr. Dharmalingam, what are the type of challenges that you as a diabetologist face in getting your patients to go for regular eye screenings?
I think the major challenge is awareness. So as Dr. Rajiv was saying, that when we tell the patient, go get your eye checked, they'll say, no, yesterday only I went, I got my glasses changed. For them, eye means either vision or it means cataract. Many of them don't understand what is a fundoscopy or a fundus evaluation. So it needs a lot of counseling. I think that is the major challenge that we have. Apart from that, if you go to the villages, I think the cost of it and even the technology, maybe, that's what we counsel. It doesn't matter. You can have a dilated exam, retinal exam just with a normal fundoscope, a direct examination. You don't have to have a fundus camera. So a lot of counseling, especially when IMA does the mass camps. So we can advise the patients if they are from the rural areas that they can go and get them done. The challenge is counseling. They should know that this can lead to blindness if they are not well treated or go for the screening or delay too much, because initially they may not have any symptoms.
Dr. Raman, how is then the medical community helping raise awareness of diabetic retinopathy and pushing for regular screening?
I think it's not only the medical community or doctors alone, but NGOs, the societies, even pharma industry. I think that's a good news which is happening today. Many of them, and I'll just take example like Shankar Nethralaya, where I'm working, way back in 90s, when nobody had even thought that diabetes can be a major problem. The founder, Dr. S.S. Badrinath, started this diabetic retinopathy screening program, which is still continuing. The societies like Vitreoretinal Society of India, the All India Ophthalmic Association, even government efforts, I would say, the National Program for Prevention of Blindness, which was very much focused on cataract a couple of years back, has included diabetic retinopathy into it.
So Dr. Ratna Devi, come in here from a national policy perspective. How can regular eye screening and treatment for diabetic retinopathy be encouraged even further?
At the national level, we do have the national, program for control of diabetes, cancer, and stroke. And this has district clinics, diabetic clinics, where a person can go and get themselves checked. We also have the health and wellness centers, which now are meant to screen for people having any risk factors and therefore be diagnosed early with diabetes. However, the fact still remains that about 1/4 of the people who are diabetic actually go for screening for any eye problems. And the problem lies at two levels. One is when they go for routine checkups, usually eye is missed. So people are aware that their HbA1c level should be checked. They know that they can have a heart attack. So they go for all these routine checks, but they forget the eyes. At the same time, the primary care physicians also do not give that much importance. So there needs to be dual awareness amongst the patients themselves that they are prone to retinopathy and loss of vision, and amongst the primary care physicians and other doctors who are screening at the district and the sub-district levels, that eye exam should be made mandatory for everyone who is reporting with not only diagnosed diabetes, but also for risk factors for diabetes.
Then Dr. Ratna Devi, come in here for a new patient of diabetic retinopathy. What are the ways in which I can get support from existing patients and patient groups in order to be able to fight the disease better?
So there are two types of patients. Some who have already been diagnosed and they have this fear that they probably will turn blind if they are not treated properly, or as Dr. Rajiv said, lots of myths and misconceptions around this. And sometimes they don't go to the right places for treatment, and they are trying to seek information from various sources. There are a lot of NGOs that are providing authentic information. 2 years back, we as an NGO also started something called Community of Retina India to support patients with low vision or with loss of vision. And there is a website called www.retinaindia.org where patients can go. They can join forums. There are Facebook groups where they can find the information that they are seeking and looking for. And then there are lots of other online resources and materials where people can search for information and join these support groups.
Dr. Ratna, what is being done then at the grassroots level to increase awareness of diabetic retinopathy? What more can be done to improve things and get more people to get their eyes screened?
There are screening camps that are now happening, organizations like say Sight Savers or Shankar Nethralaya, etc., are doing screening camps at the grassroots levels. There are a lot of civil society organizations working not only in non-communicable diseases, but also in the eye space, especially for cataract, etc., who are extending their services for screening. And these people have local material, pamphlets and other stuff that people can read in their local languages. There are radio programs, etc., where such messages are being, screened and broadcasted. And some TV programs also are showing such information so that it reaches a larger section of the population.
Dr. Vishali Gupta, are there any learnings from other countries in the screening and treatment of diabetic retinopathy that India could learn from?
American Academy of Ophthalmology about 20 years ago, it published a beautiful survey that even more than 50% of their ophthalmologists were not able to diagnose diabetic retinopathy. So as has been pointed out by the earlier speakers, that when you tell a person just to go and get your eyes examined, they might just not, the ophthalmologist may not even look at the retina, and that is the sad state of affair. So what we need to learn from them is the application of artificial intelligence, where automatically the images of the retina are taken and they are subsequently, graded as vision threatening, non-threatening, need to see the retina specialist. And Rajiv is already there. They are working in the private setup for this screening, and we have been chosen as a center by Niti Aayog because under the leadership of Digital India Initiative by the Prime Minister, there is a lot of emphasis on screening of diabetic retinopathy, and we are doing some pilot projects as to how we can train the manpower which is available in the dispensaries and district hospitals.
Doctors, we are drawing to a close of this session, but I'm going to request for closing remarks from all of you and what it is that you would like to advise people who are watching this broadcast. Dr. Raman, if I could start with you.
I'll give you an example. When we are children, nobody likes getting a vaccine. So child doesn't like to get injected, but he undergoes this vaccination because it is good for him. I think understand that is a very important aspect in diabetes, diabetic retinopathy. There are many times you may not like the process, you may not like what is happening to you, laser, injections, but that's good for you.
Dr. Mala?
Prevention of the comorbid conditions, especially microangiopathy, which is completely preventable, like the kidney disease, the nerve disorders, and the eyes, the retinopathy, should be focused on because this is completely preventable. Patients should control their blood glucose, and prior to that, they should screen for diabetes. They should not be scared, oh, I'm diabetic, I will have to restrict my food. If necessary, for a good, healthy life, whatever is necessary, we need to do.
Dr. Gupta?
With diabetes, just first thing is get your eyes checked along with the endocrinologist visit. If you are shown that you are told that there is no diabetic retinopathy, keep your blood sugar under very strict control, because if you control your diabetes, you can delay the development of diabetic retinopathy. If you are told you have very early stage of retinopathy and are given a time, please visit at that time, even if you do not have symptoms, because earlier we treat the disease, the better vision we are able to maintain it for you.
And finally, Dr. Ratna?
would just make it short and sweet and say it's better to be safe than sorry. Vision is an extremely important aspect of good quality of life. And if you lose it or if it becomes less than normal, then it not only affects your own quality of life, but also your near and dear ones. And therefore, it is very, very important that you do your regular checkups. Whether or not you are a diabetic, you should get your eyes examined as you progress with age. If you are diabetic, it is even more important that you do it even before your doctors tell you. You should be aware that this is an important organ of your body and you should take good care of it, because once you lose your vision, then it is not going to come back, and maintaining what you have is going to be even more difficult.
I'm going to thank all of you, Dr. Raman, Dr. Gupta, Dr. Dharmalingam, Dr. Ratna Devi. Thank you very much for your time. This conversation has been enlightening. I think the lesson that we take away from this conversation is be aware of diabetes and be aware of diabetic retinopathy as well. And for all our viewers, don't forget to take the Netra Suraksha self-checkup questionnaire on www.news18.com/Netra Suraksha, and also ensure that all your loved ones take it to fight against diabetic retinopathy. Thanks very much for watching.